Hi, I'm Angie Steiner, Director of Business Development and Public Information Officer for Davies Community Hospital. Today we'd like to share some important information for you, the public, and for anyone who's interested in more information about what we're doing about testing during this pandemic. Right now I'd like to introduce you to Keith Miller, who's our Chief Operating Officer.
Thanks, Angie. So we're coming to you today from the intersection of Northeast 15th Street and Grand Avenue here in Washington. And as you can see behind me, there's a large tent. That is our respiratory care screening site, which will open up this coming Monday. The hours will be Monday through Friday, 8 a.m. to 7 p.m., Saturdays, 9 to 5, and Sundays, noon to 4 p.m. will be the hours of operation. We're going to take a walk up and take a look around the site itself, and we'll hear from our advanced practice provider, Andy Houchins, on what to expect when you're at the site.
Hi, I'm Andy Houchins. I'm a physician assistant at Davies Community Hospital. I want to answer some quick questions on when should I come to the remote screening site and what should I expect. First and foremost, our best weapon against the coronavirus is social distancing. If you have minimal symptoms or no symptoms, you should stay home and be safe. If you have severe symptoms that you think may be life-threatening, especially increasing shortness of breath, then you still need to go to the ER. This site is intended for patients with milder symptoms, specifically with a cough, new onset shortness of breath, a fever, and increasingly worsening symptoms that haven't responded to over-the-counter treatments. Now, not every cause of upper respiratory symptoms is coronavirus. There are many different possibilities, and we plan to be able to screen for a wide variety of symptoms and illnesses, such as strep, influenza, and coronavirus as appropriate.
We're going to ask a few common questions that you may have, and hopefully these answers will help you determine whether or not this is an appropriate place for you to come if necessary. We'll start with Andy. Can anybody come to this site to be tested?
Yes, this site is open to the public.
I don't need to go to a doctor first or call a number first?
No, you do not need a doctor's order. It is intended to maximize access for all of our customers.
Should I go here or the emergency room if I'm worried about my illness?
If you have mild symptoms you don't feel are life-threatening, then you should come here first.
When should I go to the emergency room if I'm having symptoms?
Symptoms that you should seek treatment for are prolonged fever, increasing shortness of breath, cough, and symptoms that are not responding to at-home care.
If I have a test done here at this site, how soon will I have my results?
Some of the tests we perform here will be rapid studies, which will be available within 20 minutes to an hour. Other tests will require send out, and we will send you home for quarantine precautions and then call you with results.
So, Andy, just for clarification for our folks, when you say some of the tests that we do here will be resulted immediately, is that the COVID-19 test?
That is not the COVID-19 test. We will be providing the rapid flu and rapid strep on site, as they can cause very similar symptoms to coronavirus. Any other respiratory viral panels to include coronavirus, if appropriate to be ordered, will take a matter of days.
And can you walk us through the general populations based on CDC guidelines who would qualify for a potential COVID test?
We would love to test everybody in this situation, but currently that is not possible based on a lack of supplies. The highest priority patients are going to be anyone that has symptoms bad enough to be taken to the ER, so life-threatening situations, then healthcare workers, and then patients that are 65 and older with more serious pulmonary symptoms.
And so those healthcare workers who are concerned, we would encourage them to come here if they also develop symptoms of potential COVID-19 or coronavirus and they've had potential exposure in their job?
Yes, if there is a concern for an illness like coronavirus, worsening symptoms, or known exposure, you should contact us first to get screened.
And you mentioned ER care and making that decision between coming here, using telehealth, using the hotline, or going to the ER. Just clarify a little bit for the patients. If somebody comes through this site and our team's assessment determines that they are sick enough to potentially need hospitalization, can they be taken here by this staff over to Davies Community Hospital ER for ER care?
Yes, we will coordinate directly with the ER. We will provide the appropriate protective equipment to include masks as appropriate and get you taken directly to the ER for additional care as appropriate.
Thanks, Andy. We also just want to encourage the public to just be patient. We realize a lot of folks have a lot of unknowns, a lot of concerns, but be rest assured that we're putting steps like this in place to be as prepared as we can and do the best we can to get folks the care they need when they need it and protect our community, our patients, and our providers. Just of note, as of this morning, state reports there still are no confirmed cases of COVID-19 in the state or in Davies County. We're watching that closely and continue to watch our Facebook page for additional updates.
And I just want to remind everybody to practice their safe social distancing, to wash their hands anytime you can. Anytime you pass a sink or think about a sink, wash your hands. 20 seconds, sing happy birthday or whatever it is to get to that 20-second mark. We just want everybody to be as safe as possible, and we wish you a happy, healthy, safe weekend.